The clinical presentation of Fabry disease can be classical, as we see in male patients, with almost the triad of involvement of varying degrees of these three different organ systems: kidneys, central nervous system presenting as strokes, and also heart with enlargement of the heart. We call it cardiomyopathy, hypertrophic cardiomyopathy. And they have presenting symptoms with specific eye findings called cornea verticillata. These are the specific whorls. And also angiokeratomas in clusters in the saddle area around the umbilicus and the buttocks. There is also facial involvement in Fabry disease, and the male patients with classic presentation may evolve to have coarsening of the facial features, and you can identify them as you look at their childhood and progressing adult pictures. Some common presentations include acroparesthesias, which are the tingling pain in the hands and feet that is usually precipitated by fever and or disease or other stress, getting tired. Abnormality is sweating, either lack of sweating, and many children actually when they play in the sun, they develop feverish episodes, or when they present very young, the moms usually present discuss with us is the having recurrent unknown fevers. And later through the adulthood, the serious cardiac and renal problems may arise. And if untreated, the average age of a male with classic Fabry disease around 40 and 45 years of age. And there is an attenuated version of Fabry disease that used to be called cardiac variant, but we know that there is a whole spectrum of milder version, and this presentation is usually called by variants on the GLA gene that can produce some sort of enzymatic activity, whereas the classic ones is a whole mixture, but usually you have very little enzyme activity, usually less than 5%. The standard of care is enzyme replacement therapy. You can replace the deficient enzyme. There is a recently approved oral medication, migalastat, which acts a different way than enzyme replacement. It makes the protein more functional, and that in the cell, that the functional protein may turn down this unwanted lipid. But we are living in very exciting times because there are numerous treatments are being developed.